Knock, knock, knock.
Come in.
Hi, my name's Sonya. I'm a student nurse, and I'm going to do a head to toe assessment on you if that's all right.
That sounds fine.
Okay, great. I'm just going to wash my hands really quick and put on some gloves. So basically, all I'm going to do is just check you out from head to toe, give you a couple of pokes and prods. All right?
That sounds great.
Okay. Could you verify your name and date of birth for me, please?
Yes, my name's Jacob Jansen, born 1995, September 21st.
Okay, great. Thanks. Do you know what day it is today?
Yes, it is July 10th.
Okay, great. And what brings you to the hospital?
Some head pain.
Okay.
Mm-hmm.
Do you know what city you're in?
Yes, San Francisco.
Okay, great. Are you in any pain right now?
Just a slight headache.
Okay.
Yeah.
How would you describe that headache? What does the pain feel like?
I'd say it's in the forward part of my head. And it ranges between more of like a dull and sharp pain.
Okay. And does that pain go anywhere else?
No, I think sometimes it varies, like where my head, but mostly towards the front.
Okay.
Mm-hmm.
On a scale from 0 to 10, how would you rate that pain, with 0 being no pain and 10 being the worst pain?
I'd say right now maybe a 5, and it ranges between 4 and 6 when I feel it.
Okay.
Mm-hmm.
All right. And what makes it better?
I think a lot of times rest,
Mm-hmm.
drinking water.
Okay. And how long have you had this headache for? When did it start?
Well, it hasn't been fully consistent. I think I've had it for maybe a few hours today, and then on and off for maybe a couple weeks.
Okay. And how does that affect like your everyday activities?
It doesn't prevent me from doing anything. It is a bit of a nuisance, but.
Okay. Oh.
Mm-hmm.
All right. Well, we'll go ahead and start examining you. Okay.
Sounds good.
So again, with my gloves on, first I'm going to start with your head, and I'm going to feel around your scalp, and if anything hurts, please let me know. Okay.
Mm-hmm.
Okay. No masses or lesions, and then I'm also going to check your sinuses. So I'm going to push a little bit on them, and let me know if they hurt.
Mm-hmm.
I'm going to go in here too. Okay, and I'm also going to check right here, and one more. So, okay?
Yeah, no pain.
Okay, good. And then I'm going to check your ears too, so I'm going to tug on them a little bit.
Mm-hmm.
Okay. Alright, no fluids or anything, and cranial nerve 8 is intact because you can hear and follow directions as we go along. I'm going to ask you if you can take off your glasses, please.
Okay.
Thank you. And then I'm just going to feel around your sinuses, around your eyes, okay? Anything?
No.
Okay, good. And then I'm going to check your eyes. Your sclera is white and clear, and then I'm going to pull down on your eyes. And the conjunctiva is pink and moist, which is good. And then I'm going to grab my pen light really quick.
Okay.
Okay, sorry about that. So I'm just going to ask if you can follow the pen, okay?
All right.
Okay, cranial nerve number 3 is intact, and then what I'm going to do is use the pen light to check your pupils, okay?
Mm-hmm.
So just look right back at the window there.
Mm-hmm.
Okay, I'm going to do one more time. Okay, your pupils are equal, round, and reactive to light, and they are accommodating. So cranial nerves 3, 4, and 6 are intact.
Okay,
Okay,
great.
great. And then I'm also going to use the pen light to just check out your mouth. So if you could just open up. Okay. The tonsils are 2+. The uvula is midline. Dentition is intact, and the mouth looks moist. And then if you could just stick your tongue all the way out. Say ah.
Ah.
Okay, great. And then if you can do your tongue side to side. Okay, great. Cranial nerve 12 is intact. You can put your tongue back in. Thanks. Okay. And then what I'm going to ask you to do is just go ahead and swallow while I feel on. Okay. And then I'm going to ask you to move your head side to side. And then all the way up. And down to your chest. And then we're going to do it again with some light resistance, okay?
Okay.
So go ahead and turn towards my hand. Okay.
Mm-hmm.
Turn towards my hand.
Mm-hmm.
And then try to go down. And then try to go back. Okay. Cranial nerves 9 and 11 are intact. And now we're going to move on to listening to your heart sounds, okay?
All right.
So what I can do is I can go in through the top of your shirt, and then I'll ask you to lift up your shirt in a moment.
Okay.
Okay. First I'm going for the aortic area. Okay, good. Regular heartbeat, and S2 is heard the loudest here. And then going over to the pulmonic. Okay. And then if you could lay back and lift up your shirt, please.
Okay. Lay down.
Yeah.
Okay.
Thanks.
Okay.
Okay, I'm just gonna raise it up a little bit.
Mm-hmm.
And then I'm going to listen to the tricuspid and the mitral areas.
Okay.
Okay, in the mitral, where S1 is heard the loudest. Okay, great. Regular heartbeat, no other sounds, and I'm going to go back through with the other side of my stethoscope.
Okay.
And right now I'm listening to see if I hear any murmurs. Okay, and then we're also just going to listen to your lungs while I have you in this position.
All right.
So I'm going to start at the top here. Good, no adventitious sounds, lungs sound clear. So we just did 3 spots on the anterior, and then I'm going to do 1 spot on your right side to listen to your right lobe, okay?
Sounds good.
Great. Okay, and then I'm also going to do 4 spots on your back. So you can just be seated upright for that. And I'm just going to lift up your shirt if that's okay.
Mm-hmm.
Okay, I'm going to start at the top of the back. And I'm just going around the curvature of your shoulder blades. Everything sounds clear. And then one more time I'll have you lay on your back so I can check out your abdomen.
Okay.
So what I'm going to do first is listen for bowel sounds.
Okay.
Okay, great. Normal bowel sounds, not hyper or hypo-reactive. And then I'm going to do some light and deep pressure and let me know if that hurts, okay? Light, a little bit deeper. Light, a little bit deeper. And then what I'm going to do is I'm going to put pressure right here and then I'm going to let go. Does that hurt? Okay, great. So we can put your shirt back down. And then you can sit upright again. And then if you could just reach your hands out like this and grab my fingers as hard as you can.
Okay.
Okay, equal grip strength. You can let them go. Thank you. And then what I'm going to do is check for your capillary refill. Okay, good. I'm going to check this hand. Okay, good. And then I'm just going to check your radial pulses. Okay, they're equal. 2+, not bounding. Okay, and then you can leave your hands like this and just close your eyes and tell me where I'm touching, okay?
Forearms, palms, left bicep, right thumb.
Okay, great. And then if you could stick your arms out straight, and I'm going to try to push them down, but try to keep them up, okay? Okay, good. And the same, but I'll try to push them up. Okay, good. You can put your hands back down. And we're going to do the same thing with your shoulders. So shrug your shoulders up like this. And then try to push them down. Okay, and then I'm going to have you make a couple faces for me. Can you raise your eyebrows? And puff out your cheeks. And smile. And frown. Okay, good. And we're going to do the same sensory testing with your face. So just close your eyes.
Forehead. Left side of my chin. Right cheekbone.
Okay, great. And then I'm also going to check your carotid pulse here. Okay. Okay, they're equal, not bounding, about 2+. Alrighty, and then I'm also going to do the sensory testing on your legs. So just close your eyes and tell me where I'm touching.
Okay. Right knee, calf. Thighs. Left shin.
Okay, great. And then are you able to kick out your legs like this? Okay, great. Great. And then can you do that again while I put some resistance?
Sure.
Okay, good. Perfect. And then I'm just going to check your ankles and feet, okay?
Okay.
So I can help you take off your socks. And first I'm going to check your ankles. No edema, no pitting. And then I'm also going to check your dorsalis pedis pulse. Which is usually very light. But I think I feel it. Okay, great. And then I'm also going to check your capillary refill, so I'm going to squeeze your toe. And squeeze your other toe. Okay. And then can you point your feet up to the sky? And then can you kind of go on your tippy toes like that? Okay. Good, good. Alright, great. And then I'm just gonna make sure there's no like cuts or sores on your feet.
Mm-hmm.
Okay, and then the last thing that we're gonna do is a quick balance test. So if you can just stand up,
Mm-hmm.
have your arms at your sides, and close your eyes,
Mm-hmm.
and stand for 20 seconds. Okay, that's a negative Romberg test, so you're able to stand on your own.
Mm-hmm.
And then the last thing we'll do is just walk like this, heel to toe for a couple of steps.
Okay.
Okay, great. And you can come back and sit down. And I'll get your socks back on.
Okay.
But your assessment's all done, and thank you.
Great, thanks.